Thank you for joining us for this important conversation. We have attendants that are in person, and we're also streaming this. So hello to all of those who are on Zoom and streaming in for this important conversation. My name is Vanessa Briggs, and I'm the president and CEO of the Alliance for Health Equity. And before I get started, I just want to acknowledge some government officials that are in the room. Commissioner Maxwell is here, and thank you so much for your participation. And we are waiting for Commissioner Moskowitz to join us momentarily. So with that being said, I just want to say a special thank you to our sponsors for this particular event, Imprints Fund for Chester County Community Foundation. We're extremely grateful for your participation and sponsorship for this particular conversation, because the Alliance for Health Equity is not a stranger to Let's Talk. We actually had a Let's Talk Allyship Part 1, and with further ado, we had a high demand for a Let's Talk Partnership number 2. And so here we are, really trying to talk about allyship, why it's important, and particularly with the issues that we're really trying to deal with within Chester County, more specifically the hospital closures. And so here we are again having another tough conversation, because we at the Alliance for Health Equity recognize that the issues that we're trying to solve for our community as well as across Chester County requires cross-sector partnerships. And in order to do cross-sector partnerships, you have to be allies. And so that's why we're having this conversation, and we're really excited of our panelists that will be introduced momentarily. And so when we talk about the hospital closures and when the news broke, I was completely devastated, didn't know quite what I was going to do as a leader of the Alliance for Health Equity, but I fundamentally knew we had to do something. And so what did I do? I called Representative Dan Williams and I said, look, we have a hospital that is closing in our community. What are we going to do? And so we put our heads together and said, we need to make sure that there's local voice and local action. And so what we did, we quickly sprung into action and formed what we called a leadership task force. And many of those members, the 20 members that represent a variety of cross sectors, are actually in the room and hopefully on the Zoom call. And so when we put the call out and said, hey, would you like to be on our leadership group? We want to discuss hospital closure and try to help figure out how to solve some of these issues. No one turned us down. And so I'm truly grateful for Representative Dan Williams to say, you know what, we need to have a local presence. Because when you think about healthcare systems that close in communities, and particularly in Chester County, where you have 2 hospitals that close, there's a role for everyone. And so we knew at the highest level, working with commissioners and attorney generals, that's where the big decisions are going to be made, as well as at the state level. We also knew that there was a role for the county and all of the agencies and departments to play in hospital. But we also knew that there was a role for local. So this local task force that was put together, as I mentioned, of 20 leaders across different sectors, we sort of organized ourselves into 2 separate groups and really begun to focus on sort of the macro level. What kind of system do we need to recreate as a result of not having a hospital system in our community, in our county? And then at the micro level, we started to think about how our community, what are they going to think? How are they going to feel? So we thought about education campaigns that we're launching. We're thinking about the impact of the hospital closure and what are communities actually thinking and what are their needs. And so we're going to be launching an evaluation survey. So that's just sort of a snapshot of what we believe are critical areas that we need to sort of address. And that's what we formed, and that's what you're going to hear. And so today's conversation, really the purpose is to continue that thread of allyship, to say when you have multiple people working together, great things happen. But we also have to understand the needs of the community and how to include the community voice when you're trying to solve these deep, complex issues such as a hospital closure. So you'll have lots of discussion with our panelists, and we're going to be hearing their different ideas and their different thoughts, both at the systems level as well as the community level, because we're all sort of in this, we're all in the same boat rowing at the same time. And I think it's really wonderful when you can get this cross-sector both from high level all the way down to community level, to really come together and address what are the issues that are most near and dear to a community, particularly when a hospital is no longer here. So without further ado, I would like to introduce Nicholas Torres. He is the Chief Operating Officer for the Alliance for Health Equity. He's going to serve as our moderator and help to facilitate the conversations across our esteemed panel of panelists. And so with that, Nick, I'll turn it over to you.
Well, welcome everyone, and it's a pleasure to be here, and welcome to our online guests there. So I just first want to welcome our panelists. And so we have Linwood Smith, who's representing the community voice in terms of this, or community perspective, I should say. Harry Moore, who's representing the emergency services. Patrick Bokovitz, who from the Department of Human Services. Jeanne Franklin from the County of Health Department. Commissioner Marian Moskowitz, and representing, it is not Dan Williams, as you can see, but it is Bill Schoell. So thank you for taking the time out of your day and sharing with us your expertise and your perspective on the hospital closing. Again, my name is Nicholas Torres, and I'm the CEO for the Alliance for Health Equity. And the way we have this structured today is each of them will give a perspective for about 5 minutes. If you have questions for those in person, there's cards on your chair, so feel free to write your questions. Sophia will collect them and then bring them up here to Vanessa, who will decide which questions get to be asked. For those online, please put them in your chat box, and Alyssa will be collecting those, and we'll circulate those back to us too. And then for after the presentations, we'll have a Q&A discussion period of time. With that, we're going to start with the state's perspective. So I'll turn it over to, I had a nice introduction for Representative Dan, but he's not here. So Bill, I'm not going to do your introduction because I didn't research you, but Bill, the floor is yours. And we ask you to speak into the mic just so that those online can hear us.
Thank you so much, Nick. And Representative Williams sends his regrets that he couldn't be here today. It's been a very busy week with things stacked up all over the place. And as Nick mentioned, I'm, of course, not Representative Williams. He is much more handsome and much better dressed on pretty much every day. So anyway, Representative, this is something that Representative Williams and I talk about quite a bit. We'd actually been discussing even before the recent hospital closures, and we're fortunate to work with Vanessa on this program and just in general in getting information from the community about what's needed. And of course, it's, we certainly need the hospital, right? We certainly need an emergency department closer. And quite frankly, maybe more services than Brandywine offered at the end, right? We certainly need a behavioral health center for the county. So, but even long before that, there are issues right here in Coatesville in the area that we were looking at, right? There's not many doctors in the area. There's urgent cares close to Coatesville, but none in the area. So even with that in the hospital itself, transportation is one of these issues. It's not just the hospital or even specifically healthcare itself, but providing access to healthcare, making sure people are aware of and know how to navigate the penny system, which is, for those of you who don't know, that's Pennsylvania's own version of ACA or Obamacare, which is Pennsylvania took it over themselves, which is a great program even compared to other states. So, we try to engage the constituents when people call us with issues. We try to help them get into that program. So I just wanted to bring that up first. And there's some other, we just have some questions I wanted to go over real quick. The first one is the effort that the state is making that we can share from Representative Williams' office. The budget's right around the corner. It's an annual mess. Of course, Representative Williams is pushing for even more money for the penny program and everything in human services, even in education, a lot of things that touch on healthcare. But specifically, he and Representatives Howard and Schusterman from other parts of Chester County are introducing legislation that's based on the closing of Brandywine and Jennersville hospitals, but should apply for the rest of the state. This hasn't been introduced yet. I believe we're looking for one signature on it still, but it already has about 27 or 28 co-sponsors. For those of you who don't know, a similar thing is happening over in Delaware County. with Crozier Hospital, okay? So and has happened in Philadelphia, and inevitably it's going to happen around the state. What this legislation would do is it would require approval from the Pennsylvania Department of Health before any hospital or hospital system can be purchased. So in other words, the state would be involved in this transaction. Part of it would be that you can't close without having somebody to move in, right? Or proving that that's not necessary in your area, right? The state would not get involved in who purchases, purchase prices, or anything like that. But you have to cover the area that you've agreed to cover in the first place. And if not, there may be implications for the rest of your hospital network. And, well, I kind of hate to pick on Tower Health, but not too much. So, for instance, in a case, and now this isn't in place now, but in a case with Brandywine and Jennersville, okay, you close here, you might be looking at an impact to what happens at Reading Hospital, right? So it has a little teeth to it. The DOH would review applications, also hold public hearings, and prepare impact statements and help line things up for the public when a private business like a hospital changes hands. It would also require price transparency from any hospital or hospital systems, not just on that sale, but in any services they provide, right? We've all heard about the $30 aspirin you get when you're in the hospital, right? Well, you have to provide the cost now and say, yeah, we only pay 16 cents a piece for these, but we're charging $30. And, you know, can't force them to say, oh, no, you're only going to sell it for 25 cents if you buy it for 16. But at least provide that information, make it transparent so the public understands and has the option to say, you're only paying this much, why are you charging me this much? So that's the gist of that bill. Like I said, it should be introduced next week when they go back to session and get a bill number on it. So the next thing I have here is the formation of allyships and discussions at the state level around this issue for Chester County so we don't face another closure. Well, look, quite frankly, from the legislative perspective, this is the best thing we can do, right? Get people that are professionals that are out there on behalf of the public involved in the process. In this case, that would be the Department of Health. And I would assume that the Chester County Health Department would get involved also, but we can't legislate on that one, unfortunately. But a lot of it is just working with all the players, and it's not just the hospital companies or owners, right? In our office, and Representative Williams, we deal a lot with different provider groups, okay? And that's not just the healthcare groups. That's not just the administrators at the hospitals, right? But groups of nurses and the nurses union, groups of doctors, private practices, who all want to see the same thing. And look, these people have to pay their bills, and you know, I still think it's supposed to be a pretty good paying job to be a doctor. And you've all heard about all the headaches with student loans. Imagine after that much schooling, what you're looking at, right? So we're not saying we need to cut them out, but we want to keep them in the discussion. Also, those healthcare providers that I mentioned, health insurance companies, right, who are involved in our process, even if you're on Penny, right? You have that public-private, essentially, coordination. And also community input. That's really, from Representative Williams' perspective, that is the most important part, and what's so great about the meetings we've been having for the past couple months is we certainly need a hospital, we need an emergency room, we need a behavioral health center. Everybody knows that. But what do the people of Coatesville need, right? What do the elderly residents up at Freedom Village who moved in close to a hospital need? Or even a better example is Jenner's Pond. I don't know if you're all familiar with the area, but there are at least 5 or 6 large 55-plus communities, plus Jenner's Pond, right? Plus Ware and Oxford, right? And a couple other facilities around there. And the only reason they chose that location is they were so close to the emergency department, which is now gone, right? So what are these people looking for a replacement that comes in there? Or what other types of facilities may be able to take care of their needs, right? And it's, in some cases, it's going to be an urgent care, but in a lot of cases, it's not, you know? And how do we promote businesses coming in, be it in urgent care or even just a simple family doctor's office, right, to provide that care. So those are the kind of things that we're working on a regular basis. So it's not just the legislation, but that is a big part of it. But Representative Williams is very aware of his responsibility to help the community outside of passing legislation and make sure that people can get a senior septic card or all the other stuff, help with their employment, right? There's more to it than that. And that's the way we try to look at it every day.
Great. Thank you, Bill. Thank you so much. A couple things you said in terms of transparency, accountability, and I think the last thing was, do we know what everybody really needs because of the hospital closing? And the survey you have on your chair or online, we'll be sending it to you. That's exactly the questions we're asking, is to figure out, can we assess from you where we need to go, but let's ask from the community perspective. So thank you. Next, I have the honor to introduce Commissioner Marian Moskowitz. She has 3.5 decades, and this was on your bio on your webpage. So you aged yourself. I didn't age you, but you said 3.5 decades in growing and strengthening Chester County, and really has dedicated this through building infrastructure for the area. So, Commissioner?
Thank you, I think. I don't know. No. Look, it's great to be with you and talking about these issues that are affecting our lives every day here. So we all know that the impacts of these closings have been devastating to our communities. And I hate to sound like a broken record all the time, but our focus remains, the county's focus. The Commissioner Maxwell's here, Commissioner Kickline and I are working almost every day on this issue, trying to find prospective buyers. But we have to remember the Tower is a private entity. It is a for-profit hospital. And at the end of the day, we can't tell them who to sell to or who not to sell to. We can't tell them that we have an excellent potential buyer and they have to take it. We can't do that. So we all play this kind of game, right, where we talk to people all the time, good, solid people, local community hospitals, far away places, anything we can do. But at the end of the day, it's Tower that has to make that ultimate decision. I do think, however, that we are getting close to a kind of time crunch in the process, because within 1 year of the closing, if Tower doesn't sell to another hospital, that hospital cannot use Tower's license. So they would have to start all over again. And I think that's a major, major stumbling block. And I think it's a positive thing for us, because that window is closing. And so there are some really good people interested in it, people who will care about this community. And but again, it is a for-profit. It is not owned by the county or the state, and it's not a nonprofit. So it's very hard. Even, Bill was talking about the legislation, but again, you can only do so much to a for-profit. I would just add, because I didn't hear you say that, one of the important things for us is that we have to have more notice than 90 days. And I think that is in that bill, yes, but I'm not sure. Because 90 days is not enough for a county to do anything. It's just not. By the time you find out, you're scrambling. In fact, I was having lunch with Vanessa the day we found out, which was just ironic. I'm sure you know what that lunch led to. But it was a scary time, and it is a scary time, and we have to do whatever we can do to make sure that we have health services for this community. And for Josh, who's here, and me, we represent 500 and close to 40,000 people in this county. And when we talk about Tower and we talk about Brandywine and Jennersville, we also are keeping a close eye on Pottstown and Phoenixville that just got a decline in their rating to a D, because all these hospitals are in our county. So let's see, what else do you have? Partnerships. I love partnerships. Partnerships are a really important factor of life for me. And while it's true that there's so much angst right now with all these hospitals, look what's happened on the good side. This community has come together under the leadership of Vanessa, and our legislators have come together. our schools and community have come together on behavioral health. So it's really a moment in time where we can sit back and look carefully at the needs of this community and other communities. We have Jennersville as well right now, and talk about where we go with mental health, where we go with medical needs. Do we need a full-service hospital here? I'm not sure. Hospitals are changing the way they do business, and we have to, whoever comes in is going to have to think creatively about what makes sense. There's a payer mix, there's all kinds of issues that come into play. And so I think the nature of hospitals across the country is starting to change, and I'm sure Jeanne knows more about that than I do. But you know, from the moment news of Towers closing came to be, we had Representative Lawrence, Representative Dan Williams, Senator Comita, Senator Muth, myself, the commissioners Maxwell and Kickline, and our staff. We all went into high gear trying to figure this out. And that's a partnership right there, right? So I want you to feel good knowing that everybody is working on this every day. You may not hear about it, and you may not see it, but everybody is doing it, all the groups out there. Vanessa is looking more closely at the Coatesville area and the surrounding area right here, but there are also obviously the issues in the southern part of the county as well. Let's see, there's so much going on. One of the things that has really been devastated was the emergency management, the hospitals, you know, the ambulance providers, all of those things, the wait times at the hospitals. But we, with our emergency service center, we put the EMS council together with the fire chiefs and the police chiefs, and they are working, and they're doing such an amazing job getting people where they need to be. A lot of people in Jennersville are going to Christiana Care, Delaware. And then when you talk about the Brandywine, people that would normally go to Brandywine, they are going to Chester County Hospital, and some to Mainline Health, Paoli Hospital as well, and I guess Riddle. There are wait times, there's no doubt about it, and travel times on an ambulance is longer, but our emergency responders are working so very hard to make sure that you are safe and they're getting you where they need to be. We've started, I don't know whether you've seen it, we started a web page dedicated to resources for hospital needs. If you need a hospital, maybe you need an urgent care instead. So we've laid that all out on www.chesco.org/hospitals. I think you'll find that very helpful. And I know that Jeanne and Pat and Harry Moore are going to be giving specific information on the health department, human services and emergency services to address those gaps. Now we do have the drug and alcohol services and our mental health needs, because with the closing of Brandywine, we lost 64 beds, which is, that's what we had in the county, and it wasn't enough to begin with. So there are some things happening. Mainline Health put 20 beds in the Bryn Mawr facility. It's a little far, but it's 20 beds that we're all kind of fighting for right now, I think, all the counties. And Chester County Hospital is working on a partnership with Haven, which is Haven Behavioral Health, to add some more services for mental health and inpatient. So hopefully that will get going soon. I think they're starting to work on the building, but it's going to take a little time. It's still not going to be enough, but it is a start in the right direction. And I think that the next thing I would mention is for the mental health. The other issue we're finding, part of it is from COVID, part of it is just life, I think, even before COVID, is the issue with our students in our schools and the impact that all this has had on them. So on top of not having things like Brandywine Mental Health Facility, we have a lot of children that need services. And so Representative Sappy has put together a very large task force of legislators, our commissioners, the CCIU, county staff, and others who are just working on ways to deal with students' mental health. So that's a really important thing that's going on you should know about. The superintendents have really tried as hard as they can, but they need help, and we have to make sure that they have it. So I think that's, I think I've responded to all your questions, Vanessa, I don't know. But I appreciate being here. I think this is an important discussion, and I'll turn it back to you.
Great. Thank you, Commissioner. And as we transition, it's, with a crisis in the general area, there's also opportunity. And one thing what that allowed us to do is to put this task force together and really focus on maybe things that we cannot control, such as a closing hospital or what happens next, but things we can control, which is really building an integrated health system and looking at the prevention side of it. So with that, I have the honor of introducing Jeanne Franklin, and a quick thank you to Jeanne, because when we brought the task force together, she was one that stepped up and said, I have some funding that can help us get us started. And that has allowed us to launch an educational campaign, which will kick off after Labor Day, and also the community survey that will help us get a real sense of how the community's needs have changed. So thank you, Jeanne, and I'll turn it over to you.
You're welcome. Pleasure to be here, everyone, both in person and those online. I echo a lot of what my speakers to my left have said, and our focus, as you know, Chester County Health Department serves the entire county, but when an event like this happens, is we kind of go into our mode of getting involved in those first steps of what is really going on, what's here today, and what could happen tomorrow, so we can work with all of partners, such as those at this table, to try to mitigate it, lessen the impact. So unfortunately, these hospitals closed with little notice, as you've learned, so we went into hyper-focus mode. And we went into hyper-focus mode while coming off of COVID and IDA, and I'm not speaking from the health department, I'm speaking from our community level. So this was just another, almost smack in the face. But we're Chester County, we come together, and one of the first things, as Commissioner Moskowitz alluded to, is the county established its own task force. Some of us are here today, but there's many others involved, and really our charge was, don't worry about if it's gonna close, because we all read the articles, oh, maybe they won't, maybe they found a buyer, oh, they're off, they're on. It was, assume they're going to close, and let's plan accordingly. And that's really what our charge was. And the health department was a part of that, and we met regularly. And again, it was to focus on how do we lessen the impact, how do we get the facts correct to our community, how do we get the right information in the right hands. And the website was one aspect of that, and you may hear from Pat. With human services, it was how do we partner with those across county lines to ensure we have beds, or folks know where their nearest urgent care is, or many other options that we had. Much of that early work was data collection as well. You never realize what you don't know until you're in a crisis. So we did a lot of that data collection, so we knew if we're here today and something changes, is that change positive or negative? And then what do we need to put in place to handle that? So as a health department, we got involved in both regions, both Coatesville and the Jennersville. In the southern Chester County area, they have a phenomenal network. It's the Southern Chester County Opportunity Network. It is a fantastic group of shaker up, people who shake things up, people who get things done, various nonprofits, various skill sets and focuses. But as we've learned, it takes a network of folks. It's not just health folks. It's food, it's housing, it's everything else. So the health department was involved with this group already for other important issues, but this is the one we brought to that community because Jennersville, it happened before Coatesville's closure, and we didn't have that community voice. So our ask as the health department to all of those in that network were go out and ask those you serve, those you engage with, what are you hearing, what are you feeling, what do you need, what don't you have that you want? And a lot of that has come through word of mouth. It's very interesting how two different regions, both with a hospital closing, take on the crisis in different ways, but both effectively. So we continue to meet with them. As a matter of fact, they're eager to hear kind of the output of this discussion, and in anticipation they may have to do a similar discussion in their area. And then in Coatesville area, as you heard, through the task force that both Nick and Vanessa had mentioned, the health department became a member of the Coordinated Health Services Work Group. That was really, a group focused on short-term and long-term solutions. Some of the short-term are just understanding what are some of the possibilities, what's already there, how can we engage with existing partners. It's a pretty big ask to take the volume of patients and services a hospital like Brandywine provided and disperse it amongst those already in the network. But both communities, Southern Chester County and Coatesville, have fantastic federally qualified health centers, both of which are sitting here today. And they would welcome additional patients. May not be able to provide all the services, but having that connection to a key health center is critical. And it also, in those longer term solutions, the integrated health service system that's been mentioned, how do we transform the way health services are delivered, with or without a hospital in our community? And Coatesville is positioned really well to kind of pilot that for the county. And what do we learn from that could be, translated to other communities without waiting for a crisis? Because this is where healthcare needs to go in general, and this is some of what hospitals are recognizing, what is their involvement in community health. Our involvement in the other work group, and both of these are nicely laid out on this flyer if you want more information on who's on it, but was the health advocacy work group that Nick had mentioned. And here we became a funder. And I love it when the health department can operate on different levels. And whether it's input, money, or action. And basically what we ended up doing, as Nick said, we leveraged our funding with our grantors to do the education campaign, which will launch in June, as well as that community survey. So it's really important that all of us get this out to our own networks and fill it out ourselves, because this is truly going to tell us what we need to do. It is one input. So after this survey, or I should say concurrent with this survey, is a larger community assessment. And that community assessment will engage focus groups with various different groups, community, healthcare delivery systems, et cetera. And all of that's going to kind of be coalesced together for two purposes, really. How do we locally leverage that information to make that transformation, to inform this integrated health delivery system model? And how do we share that with a prospective new hospital buyer to say, this is what your community really needs, and this is what will make you a successful hospital and an engaged hospital? So it's a first step, but like we know, we have to deal with the crisis, and then we move into other aspects of the crisis. And the education campaign is really part of that prevention. It seems so simple. It seems like we always do education, but you'd be amazed how many people use the emergency rooms in Chester County as their doctor. So we need to reteach, retrain ourselves, and it doesn't matter where we come from and what we look like, retrain ourselves on when do you call 911? Or when is it okay to wait till tomorrow and call a clinic, go into an urgent care, call your family for help? So they seem basic, but it is a critical step in prevention, in changing how we think about what is here today and what we want it to be tomorrow. So I'll pause there, Nick, and certainly can address more in the Q&A.
Perfect. Thank you, Jeanne. And yeah, what she said is it's the spectrum of care, right? We start with our primary care provider and all the way to the emergency room. And if we can educate the community about what's the appropriate care, then we'll do service to everybody, not only individuals. part of the healthcare team is not only our doctors, our nurses, but also some of those unsung heroes that we don't think of healthcare workers, but social workers and teachers and case managers. And so with that, I introduced Patrick Bokovitz, who is the director of human services for Chester County. And that sometimes we don't think of them as healthcare workforces, but as we think of the healthcare team, sometimes they are the ones that's providing all the information to the people who need those care. So it's a pleasure having you here, and I'll turn it over to Pat.
Well, thanks, Nick, and good evening or good afternoon, everyone. It's a pleasure to be here today. Yes, I think Commissioner alluded to how challenging the last couple of years have been, and the strain it's put on the mental health system within Chester County. So when the news of the hospital closures occurred, it was a huge impact to our mental health team, I can tell you, within Chester County government. And I say that because, quite frankly, the staff that operated an emergency room at Brandywine Hospital had created so many partnerships with the community. We had, as mentioned before, with the closure, we lost 64 inpatient beds, 16 geriatric, 16 eating disorder, and 32 adult. That's a huge impact on a already strained and lacking, if you will, of inpatient beds in not just the county, but the region. So when the announcement was made, as my colleagues from the county have said, a leadership group was put together and really started to track and identify what the gaps are and what they will show over time. We partnered really closely with the Mercy Services, tracking the ambulance deliveries to the 3 remaining Chester County Hospital, Phoenixville, Chester County, and Paoli. And really partnered with those hospitals. Staff from mental health have been in communication with those hospitals on a weekly basis to understand what are the impacts of, especially Brandywine Hospital being closed, because again, that hospital and the emergency department and those inpatient beds provided a tremendous service to us and to the community at large. So trying to gauge that, trying to understand what the impact is, while also standing up new programs, expanding existing programs. We've doubled up a program that provides wraparound services for individuals that's going through a mental health crisis, and we think we are making progress, but there's still work to be done. And with that, I'm going to pivot a little bit to a process that had started prior to the announcement of the hospital closures, and that is the development of a mental health crisis response system and a planning process, which began at the end of last year, the end of 2021. It's brought together, as often does in Chester County, a lot of community leaders. We have representatives from the schools, law enforcement, the hospitals, obviously a number of county leaders and elected officials, with the intent of developing, if you will, a mental health crisis response system that really meets our needs. From Phoenixville to Oxford and Honeybrook to Westchester, all corners of the county. Obviously the size of our county is a challenge at times, so to be responsive to all areas is really a big component of our mental health crisis response planning process. We also recognize in that process that the need, unfortunately, does not, have an age limit, if you will. We have tremendous needs within our youth, our adolescents. Certainly our adults and seniors are all experiencing some of the mental health challenges that we've spoken to a number of times today. So to be responsive is really an important component to build, to create if you will, a series of programs and services that's intertwined with the community, with the schools, with the police officers, with our EMS partners, et cetera, is really a critical piece. So there's really three components to our mental health crisis response system, and these are based on best practices across the country. The first is a call center. It's a number that someone can call when they are in a mental health crisis, and it's a really important piece. We envision it being staffed by, we're calling them mental health first responders. So many of the calls that come in, the immediate service will be critical for that individual that's answering that call. So that's the first leg, if you will, of the three components. The second is a mental health crisis response team. So it'll be teams that actually engage individuals in the community. We are planning for an adult team and youth teams, because we recognize there are differences in how individuals will interact with each other and with the person that needs that support going through that crisis at that point in time. And then the third component, and this really connects, I think, closely back to the Brandywine Hospital closure, is a crisis stabilization center. It's a facility where, for a period of time, whether it's a few hours to a few days, an individual can work with staff to work their way through within that mental health crisis and go to services outside, if you will, that facility for a longer term or ongoing basis. So those are the three components. That planning process had started prior to the hospital, but the urgency of it got ratcheted up big time with the closure of the hospital. Now, I echo Commissioner Moskowitz's comment regarding the Haven Behavioral Health and their partnership with Chester County Hospital. I think that's going to be additional. We're hearing up to 60 inpatient beds, which will be a tremendous impact for our community and help to respond to the closure of the beds here at Brandywine Hospital. But we're still, we think, a year out from that service being available. So again, staff agencies are trying to continue to work with individuals in need and connect them with the resources that are available at this time. But it certainly is an important need in our community. So I think that as where we stand right now with our mental health crisis response planning process, we hope to have recommendations released in July of this year, probably 2 months out. Some of it is starting to come together in terms of the approach that we want to have, and I sort of highlighted some of that just now, but some of that will be clarified by some of our partners. We certainly want impact from our police partners, from our school partners. It would, again, Commissioner Moskowitz mentioned the task force that was put together by Representative Sappy. That's connected to this process as well, so that the partnerships of the community members throughout the community can really speak to what this new system looks like. I would end with this comment, though, or two comments, if I will, in terms of the challenges putting this together. I think we all know, and I want to sort of highlight the challenges around workforce that we have in the county, really in all different industries. But as we look to stand up a new system to serve our mental health needs in the community, that's certainly a challenge we have. And then the second challenge I'd mention is, as it relates to the Crisis Stabilization Center, as much as it is a huge need, it's not something a lot of communities want in their community, just to put that on the table. So we are certainly trying, at some point the community has to recognize we need this. It used to be in some form or fashion at the Brandywine Hospital, and it would be fantastic if it could be on the campus of what was the Brandywine Hospital or Jennersville Hospital. But it may not, it may not come together now in that timing. So just make those two comments around some of the challenges we foresee. But I am, thankful for the staff we have within the Human Services Department of the county and the efforts they've made to date.
Thank you, Pat. So we have 2 more speakers, and then we're going to be opening up for questions and answers. So don't forget that you have a card that you can write questions to and give to Sophia, and then we'll bring them up here so that we can answer those questions for you. When I think of emergency services, I always think, while the rest of us have the luxury of time to kind of plan and think this through in strategy, the people that don't are the emergency services. And I sleep at night knowing that there's still a number I can call and still somebody that will come there and help me. So with that, I give you Deputy Director Harry Moore.
Good afternoon, everyone. Thank you for the opportunity to participate today. When we talk about today's theme of allyship, the first response from the Department of Emergency Services when we found out about the hospital closures was, if you will, to rally our troops. The silver lining, if you will, of the COVID pandemic enabled us to really strengthen our communication channels with our partners. So our EMS agency managers and our emergency department managers. So we had those lines of communication already there and open, and we just brought everybody together to say, look, this is going to be impactful. How do we address this together as a team? So those channels were there. We needed to strengthen them, and everyone came to the table, and everyone is participating in an effort to help get everyone through these struggles. So specifically for the Department of Emergency Services and our efforts in relation to the hospital closures, we are the primary provider of 911 center services in Chester County and emergency management services in Chester County. We also provide support and coordination to police, fire, and emergency medical services. I'm the emergency medical services liaison, so I'll speak specifically about emergency medical services here today. One of the first items that we wanted to address was understanding the scope of the issue. So when we heard, as the scale of the dilemma increased from 1 hospital closure to 2, when we look at how many patients were transported by our EMS agencies to both Brandywine and Jennersville Hospital in the previous years, that number came out to over 8,000. That's a significant number. Obviously, and that's only the EMS volume to those 2 emergency departments. That doesn't account for the walk-in volume. Typically, a hospital is about 20% EMS volume, about 80% walk-in volume. So it skews a little bit depending on the hospital, 25% potentially, but that's generally a good number. So the first question is, where are those people going to go? Okay, they're still going to go somewhere. They're still going to call 911. They're still going to need care. We need to identify where they're going to go. So we looked at our EMS transport trends, and they seem to have leveled out currently, and it looks like round numbers, there's some daily flux there, but generally round numbers, about 80% of our EMS patients are staying in Chester County. So for that 80% of our EMS volume, about 40 to 45% of those patients are going to Penn Medicine Chester County Hospital today. About 30% of those patients are going to Mainline Health Paoli Hospital, and about 8 to 10% of those patients are going to Tower Health Phoenixville Hospital. So that leaves a balance of about 20% that are being transported outside of Chester County. And there really was no surprises there as to where that 20% would land, and that's kind of spread out between Lancaster General, Christiana Hospital, Pottstown Hospital, Tower Health Reading Hospital, and Union Hospital in Maryland. So for the folks in the southern part of the county, in the Jennersville catchment area, believe it or not, Union Hospital is arguably closer, depending on where you are. But in that area, there's, real good options in terms of closeness. Those folks are going to Union, Christiana, or Chester County Hospital, which is a significant transport time regardless. One of the other components that we also looked at was the EMS offload time, or the ER wait time, or the time it takes an ambulance to transfer care from our EMS crews fully over to the emergency department. Obviously, with an increase in volume at those other hospitals, that increases our EMS offload time, and that just creates a ripple effect throughout the entire system. So as our ambulances are waiting longer to offload their patients, the 911 calls aren't stopping. They're continuing to come in. So we have to employ what we call mutual aid. So if Coatesville's ambulance is tied up at Chester County Hospital's emergency department, if Coatesville you're fortunate in Coatesville, Washington Hose Company staffs multiple ambulances per day, but in the event that they're all tied up and another call comes in Coatesville, then we're dispatching the next closest ambulance. So whether it be Downingtown or Keystone Valley from Parksburg, we rely a lot more on mutual aid. So we really watched our EMS offload times. This came at a terrible time, coinciding with a COVID surge. So our emergency departments were already really full with patients. They were struggling with their own staffing issues. Their staff obviously wasn't immune to COVID as well. So we saw a significant increase in our EMS offload times. I'm happy to report that that's really leveled out and come right back down to where we'd like to see it. We looked specifically at our EMS call volume. Were there any significant spikes of people dialing 911, whether that be for any type of specific emergency or any specific location? Were the folks in Coatesville City or Callan Township calling 911 more, or the folks in Penn Township calling 911 more often? And fortunately, we didn't see those spikes materialize. Everything remained fairly level. EMS call volume seems to trickle up. There's an annual increase, but we saw no significant spikes, which was a good thing. And again, it all boiled back to our regular communication with our stakeholders and identifying the data, the trends, and working with them to come up with any potential solutions or strategies. As far as the actual impact of the hospital closures on the Department of Emergency Services itself, I have to be honest and say on our department, it was fairly minimal. We stepped up our efforts to look at data and support our agencies however we could, but the real impact here is on the agencies who are the direct providers of the services. So here in Coatesville, you have Washington Hose Company, which is your EMS provider. So when you look at a normal EMS call 6 months ago where someone trips on a curb and falls and suffers an orthopedic injury, and they could be attended to, packaged, and transported up the hill to Brandywine Hospital and receive care fairly quickly. Now that same patient is transported to Chester County Hospital, Reading Hospital, Lancaster General Hospital. Patient destination is largely guided by patient choice. So as long as the patient is conscious, alert, oriented, able to make sound decisions, if they say they want to go to Chester County Hospital, that's typically where our EMS crews will transport them to. There are certainly exceptions. If you have a traumatic injury, Paoli Hospital is our county's trauma center. Reading Hospital and Lancaster General and Christiana are trauma centers as well, so there's some flux there. But generally speaking, the patients have some say. So as patients, my physician now works out of Chester County Hospital, or all my records are still with Tower Health, so I want to be transported to Reading Hospital. That's kind of how our EMS crews make that determination. What's the patient's preference in combination with the patient's presenting symptoms? So you can see now that the hospital closures have caused an increase in transport time for our EMS agencies. What used to be fairly quick runs up to Brandywine Hospital, or for example, our EMS crews in West Grove, who used to be able to run somebody pretty quickly down to Jennersville, now have to go to Christiana or Lancaster General or Chester County Hospital. So that's where the impact lies. We look at increased transport times for our EMS providers, and now with the increase in fuel, that impacts their financial piece of this with a significant increase in fuel costs. We talked about the increased out-of-service time. So the ambulance from Coatesville now driving to Chester County Hospital, once they get to Chester County Hospital, they potentially now have to wait longer to offload because of the compounding issues. So they're out of the service area here longer, which makes them rely more on mutual aid. And in some cases, they have to upstaff, or they have to add an additional unit, add additional staff, and that obviously comes at a cost to them as well. We look at the impact on our emergency departments. Obviously, there was an increase in both EMS and walk-in traffic to the remaining 3 Chester County emergency departments. they have to make space for those patients. Making space in a hospital is not something that can happen quickly. And I can tell you that our hospital partners have done everything possible to date to make as much free space as quickly as possible. They have converted offices and closets into patient care area to try to make more space for patients arriving in the emergency department. The second piece of that is they can make 10 additional patient spaces, but now they have to have somebody to staff those extra 10 spaces, which is not easy in today's employment environment. So everyone is doing everything they can in that respect, but those fixes are not quick or easy, but they are on everyone's radar, and everyone is doing everything they can to increase capacity and improve staffing. And the last point I'll touch on is the behavioral health piece. You may not equate that to emergency services, but it impacts significantly our flow in the emergency department. Typically, those behavioral health patients are kind of stuck in the ER, if you will. They most often need to be medically cleared. That's why they're in the emergency department, and that takes time. And those patients are also typically one-on-one. So each patient requires a one-on-one staff member-patient interaction. So that commits a staff member to that patient for the entire duration of that patient's stay. So one of our hospitals typically reports that every day they start the day with at least 30% of their available emergency department beds occupied by behavioral health patients. So they start the day in a deficit. So it's pretty easy to do the math. If you have a 30-bed emergency department and 10 or 12 of your emergency department beds are occupied by behavioral health patients, that has an impact on the person with the orthopedic emergency, the person with the stroke, the person with the heart attack, because there's no space or staff to accommodate that. So the ripple effect of this has been tremendous. We pledge to continue to work with our partners and our stakeholders to identify potential solutions and navigate the difficulties that we're facing. But again, unfortunately, the immediate short term, we have not yet identified any significant, easy fixes, but everyone has dealt with the difficulties as best they can. Our patients are still receiving optimal care. We're fortunate we have a resource-rich, fantastic EMS and emergency department system here in Chester County. So the level of care is still extremely high. Everyone is getting the appropriate care that they need and being transported to an appropriate facility. And at the end of the day, that's key, is taking care of everyone in our community. Thank you.
Thank you, Harry. And as we move into our last speaker, the Chris Sayo, who is going to be here, our speaker from the CEO of the United Way of Chester County, couldn't be here. He was feeling unwell. But his comments were really to this perspective of access also, right? Outside of emergency care is what to the Chester County funders kind of look at it and approach, and they said, well, access is key for this period of time, and not acute access, but not emergency care, right? And transportation was that biggest barrier. Can patients still get to their primary care provider appointments or behavioral health? And so really looking at alternative transportation systems that could really support that. And then the other one was really about telehealth, right? Just because somebody can't get there does not mean that they still can't have access to their care provider. So those are the two priorities that the funders group has really said is those are our priorities in looking at. So with that, I'll turn it over to Linwood Smith, and he is a community health and wellness advocate, but an intern elder at the African Methodist Episcopal Church, retired public school teacher and administrator. So I'm also an past educator, so glad to have you with us. Linwood?
I want to say good evening, and again, I want to thank you for the opportunity to come and represent and talk about community and the effect of the closing of the hospital, what their thoughts are, the impact, and also recommendations. You might ask the question, okay, what part of the community are you talking about? Well, I think you already heard I come as a past high school principal, retired pastor, and also in the community, I'm going to say a bartender. I no longer have that occupation. But again, I come from a number of perspectives. I serve on a number of boards, and I do my best to try to stay close to the concerns of the community. Yes, there's a great impact when you talk about the closing of a hospital. And I want to thank my colleagues for your perspectives. The big thought or takeaway today is mental health, which is a big issue. many of the committees that I'm working on, it is a major concern, and we're struggling and also pushing real hard to try to make partnerships with many stakeholders and sectors of the community addressing the same problem. But there are also other challenges that were in place even before the closing of the hospital. How about comorbidities such as diabetes, high blood pressure, and cancer? One of the concerns as a community member is some of the health disparities that exist in Coatesville and vicinity, that those challenges will be exacerbated. And that's pretty sad. And then the question is, what responsibility do we have in trying to address them? Well, it takes an entire village to raise a child. It will take each and every one of us working together. Every aspect, every person that you see here, every person in this room, and every person on the internet looking at this, and every person on, I'm going to say 919 North Walnut Street. I just picked that out. Not picking anybody. That's where I used to live in Valley Township to solve this problem. There's a great impact. You think about the closing of a hospital jobs. In the United States, 1 out of 9 jobs are dedicated to health care. Think about the persons who no longer work at Tower Health or no longer work at Jennersville. That's the impact. The hospital, community hospital, plays a major role in a neighborhood, in a community. A couple things. First of all, it builds community wealth. We have jobs. People have an opportunity to get a job, and hopefully with insurance, which is not so true in many cases. There are many employees, persons working in hospitals that still don't have adequate insurance. And when you look at some of the numbers and look across Pennsylvania, the Commonwealth, there are 3.3 million persons who are on Medicaid. That's about 1/4 of the population on Medicaid. And when you consider what will probably happen at the end of this, well, the pandemic, we're still in it. What's going to happen to those individuals? We have closings of hospitals, and then we're going to have additional persons without health care. When we talk about the role of a hospital and the impact, hospitals, they develop community partnerships. Think about some of the great programs that Tower Health and Brandywine used to run. Information on addressing health, I'm going to say addressing eating disorders, or addressing, in some cases, food insecurities or high blood pressure. Okay, that's gone. That's the impact. That's the role that the hospital plays, and now those areas are gone. We talk about access to the hospital. Of course, has already been mentioned. Transportation, the closest hospital, I think, is 30 to 60 minutes away. We're talking Chester County, depending on where you live, within the Coatesville area or within the Jennersville area. So a hospital in the community, it actually improves healthcare access. Without it, I think you already have the picture. It also builds something called social capital. I mentioned that before. Think about everyone coming together. Robert Putman, who is the author of Social Capital, but really it comes from the old African proverb, it takes an entire village to work together to raise a child. And when you think about those issues of social capital, people coming together, there's already research that expresses that those communities that were together that had health care, there were fewer incidents of COVID-19, fewer deaths in those communities. Now, again, we have 2 hospitals missing. And also the hospital, the impact of a hospital is the leader in addressing diseases most afflicting the community and vulnerable populations. We can't forget about the vulnerable populations. That's the impact. Now, how about the community response of closing? As I had an opportunity to have conversation, and I want you to look at your neighbor and say, I'm part of the community. Go ahead and say that. Right, there we go. I'm part of the community. We're all part of the community. They're just different conversations and emotions and anxiety. In one of the committees, organizations I'm involved with, one of the grandmothers said, what am I going to do with my grandson who's experiencing mental health issues? Where do I go? And there was almost a an immediate panic when she asked the question, which led at least to one group, which is the NAACP, to begin to lift that as one of the major areas to address in the city of Coatesville and figure out how we can partner with other organizations. Another question is where do I get screenings, routine tests, x-rays? What about the transportation barriers? There's also community grief. We haven't discussed that. Of course, there's loss of income, loss of job, but how about volunteers who've worked through the years? Think about my mother, father, and sister all passed away within 30 months, over a 2-year span, if you can do the math, how that works. So there's memories. Not that that's something that you want to think about, but there's a loss. Hospitals are institutions that bring people together. And also, we considered a community response of closing. I already said this. What are the diseases most afflicting my community and vulnerable populations? Another community response to COVID-19 and vaccines and emergency services already mentioned. And the last piece I'd like to talk about are recommendations and considerations in meeting the gap of services. I have 7. The first one I have here, community health report card. I think now is a great time to get a report card on the health status of Coatesville and vicinity, and not just Coatesville, but also in southern Chester County. When we talk about addressing the challenges, we can't really address the challenges until we really know what we're dealing with. Much of that information we can get from Chester County Department of Health, and we can get also from Pennsylvania Department of Health. We need to determine what are the health disparities and health equities, and the closing, which again exacerbates health challenges. Seniors, when we talk about vulnerable communities, we're not just talking about people of color, we're talking about women, we're talking about seniors, and many persons who are in other health challenging situations. We need to establish larger partnerships. We can no longer having a partnership I think is excellent, but the problem is bigger than an institution. The problem is bigger than actually any one of us. It's bigger than a name. The only way we're going to solve the closing and also trying to fill in the gap, we all have to come together and increase the circle, so to speak, in addressing the challenges, trying to be as best as possible on the same page. Still have your identity of the organization, retain that, but also come together to address the challenges. Work through existing health alliances to address health equity and advocacy. And this is a great organization, and I want to thank you again, Vanessa, and all the staff for putting this together. We must use trusted voices in the community. I did a research in 2019, and it's not about the research, what it's about Coatesville. Think about it. There's now mistrust. When the new individuals come in, there's going to be some mistrust. And how can we develop and increase trust? We have to give the organizations maybe some directions. And one direction, whenever a new vendor comes into town, or where we are now when our residents go to other hospitals, one thought it would be great to have those hospitals, the faces and the voices, actually in the community. Maybe not necessarily in that bar that I used to run, but how about in the barber shop? How about with some of the other organizations, other groups that you may not see in this meeting? Also, we need to determine a community site and location for routine health information, COVID-19, vaccines, and et cetera, to address many of the health disparities, to address many of the comorbidities that our residents are facing and experiencing. So I think that's about enough. I want to thank you. I think I have an 8th one here. You want an 8th one? Thank you for your attention.
Thank you. So we're gonna just jump right into Q&A, and I have them on Nick's phone so I can see your other messages. No, I'm only kidding. So these are questions that are actually coming from those that are on our live stream through Zoom, and then we'll open it up for questions for those persons that are in person. So I'm going to sort of cherry pick a couple of these questions because they seem to be a little bit redundant and sort of targeting Marian, Commissioner Moskowitz. But so I'll save that for last. But I think this is a really good question that maybe Commissioner Moskowitz, you can help explain, because I do think it piggybacked off of a little bit of the legislative bill that Representative Dan Williams and his colleagues are working on. And the question is, can anyone explain how for-profit hospitals have become the norm, and what can we do as citizens to change that now? That question is coming from Jeanne Morgan, and she's on our Zoom live stream.
Hi, Janelle. I wish I had an answer for that. No. So look, it's really hard to even put legislation in. I mean, you have parameters and you have laws. They all have to follow laws, whether they're for-profit or non-profit. For-profit has much more flexibility in what they do than a non-profit. And so I think that one of the things we've been working with the state health department, putting in some new guidance for the way hospitals operate. And I think that's the way to go. It has parameters that are restrictive, and things like not closing with 90 days notice. And, things like that really tighten some of the constraints on what they can and cannot do. But a for-profit is different from a nonprofit, no matter how you look at it. So,
yeah. Thank you for that response. I'll just sort of pick another question here that I think is really a good question. And since you have the mic, Commissioner Moskowitz, this question is around: is there open communication with Tower Health? So can people, citizens, residents, contact Tower Health directly and ask questions that they may have? And that question's coming from Nikki Whitlock.
hi, Nikki. I don't know. I mean, I do have contact with Tower. I try to maintain a relationship so that I can stay on top of what's happening. So the commissioners and I have a line that we can speak to them. But I don't know if a citizen calls. I don't really know where it goes. I would imagine they do have some kind of information center, but I've never tried that. So I don't know. Does anybody else know that? No.
Well, that's a great question. So maybe we can try to find that answer out, because I think that would be a great way to educate community if they want to put their voice forward. Ask them directly, so we can maybe try to find that out. This question, I think, is more of a clarifying question either for Pat or for Jeanne, and it's coming from Jeanne Morgan, and she's asking, please name again what are the trauma centers someone would be transferred to if they suffered a heart attack or stroke. I'm not sure if that question's coming from Harry, or is it the stabilization center? So maybe somebody can take that question.
So there's a difference between a trauma center designation and someone who's having a heart attack and a stroke. Heart attack and a stroke are medical etiologies. So Chester County or Phoenixville or Paoli Hospital can adequately treat or appropriately treat any of the medical etiologies. Paoli Hospital is the county's only accredited trauma center. Trauma centers in neighboring counties include Christiana Hospital in Delaware, Lancaster General Hospital in Lancaster, Reading Hospital in Reading. Those are the local trauma centers to our area.
Thank you. Pat, this question's for you, and I know we've talked today about both Jennersville Hospital as well as Brandywine Hospital closing, but this question is coming from Margaret Weinstein, and she's asking, are there any updates on the proposed closing of the VA hospital?
Well, we just had a discussion that Vanessa and Nick led this week with Representative Houlihan on it. I think the clarifying point with the VA, the Coatesville VA Medical Center, and what you've heard it in terms of the press, is that it's a little bit out there, meaning any recommendation and finalization of a new regional VA medical center will take years, if not a decade, to put together. It would have to be passed by Congress and the President, which I in listening to Representative Houlihan, does not think that's in the cards, as it were. So I think that's the the quick update is that it's out there a little bit. I think there was a report released that projected something like 14 to 16 VA medical centers around the country as possible merging in different ways. And the recommendation for our area was to create a new VA medical center in the King of Prussia area. They do not even have land to start that yet. So if you know much about land development, especially in Pennsylvania, it would take a while, even if they found a piece of ground tomorrow, to put something together. So I think it's a ways off. Something certainly to track, stay aware of, keep your ear to the ground on terms of it, because it would have huge implications to this community for many of the reasons what was stated before, and I think obviously to our veterans in the area would be extremely impactful.
Yeah. Thank you, Pat. And this is a question that's been asked multiple ways by our participants joining us live stream. And Commissioner Moskowitz, I know you touched on this in some of your comments, and the question really is updates on potential buyers. And I know you did mention that, so maybe you can kind of just quickly summarize sort of what you had discussed earlier.
So what I can tell you is that Tower is talking to potential buyers now. I mean, they have been. There have been people looking. I understand some even doing due diligence. Other than that, I just cannot really talk about anything else. I know that sounds terrible, but it's important that that we honor that confidentiality. And at the end of the day, we are just trying to work with anybody we can to make sure that Tower has every opportunity to sell those sites to some good qualified folks. And we have set up in the county, just so people know, that if a prospective hospital comes to the county looking for funds towards that purchase or operation, we have set up with a consultant to screen that potential buyer, because that's an opportunity then we have to see how qualified they are, to see what their past experience is, to see how successful they have been, and to see how they treat the community. So that is something that we can do. Other than that, it is in Tower's hands.
Thank you. So these are questions that are actually coming from our participants that are here live, and this question has to do with healthcare costs. So I think I'm going to turn it to you, Jeanne. Will there be any relief for residents experiencing an increase in healthcare costs due to the closures? Any relief?
That is a great question. None that is on my radar at this time, although I think Vanessa and Nick, that might be a great topic for our advocacy group to seek out. And this is the benefit of doing events like this, is we get such prime creative thinking. So we've seen healthcare and other assistance with other costs. I don't anticipate it being so unique to hospital closures, but there may be some other creative ways of seeking it out, and I would even venture to say regardless of the closure. If someone is in, maybe it's their first, mental health crisis, and they are strapped for the cost around that.
Yeah. Yeah, I think that is a very great question that we can take to the advocacy. Absolutely.
I mean, I think one of the exciting parts to the After Labor Day education campaign that Vanessa and Nick mentioned before is an opportunity to inform the community about all the resources that are available, including health insurance. Bill mentioned, Penny earlier, and certainly there's Medicaid for those individuals that would be eligible. So I think it's a real opportunity. We have this urgency of hospital closures, people's attention's on healthcare right now, where they otherwise may not be. So I think it's a great opportunity to make sure that we take advantage of that time to really inform our community members.
Yeah, that's a great point. And I sort of think about that question about relief related to healthcare cost for residents. Not only is it a great question to take back to the advocacy group, but it's also a question that comes to bear when we start to think about policy and practice reform. And how do you ensure that costs are affordable for our residents, particularly when we had some new interventions like telehealth that came into play, and now that's at the legislative level. Is that going to continue at the same rate, and is there going to be cost that's going to be incurred on the resident? So I think you're absolutely right. That's a great question.
Yeah, and thank you, Pat, for reminding of what that education campaign is going to also include, because, and I say this everywhere I go, Chester County at one point before the closures had 5 hospitals, 3 FQHCs, federally qualified health centers, and 2 free clinics, and yet there's still unmet need. But I know, and I mentioned we have 2 of them here. We have Chespen, who's right in the neighborhood, and we have LCH Health and Community Services, who is in the southern Chester County area. They work their magic to help people who don't have enough funds for their health care. Community Volunteers in Medicine in Westchester draw from lots of different areas of the county. They're a free clinic. They have, and then there's the free clinic also in Phoenixville, and then Pottstown area also has another federally qualified health center. So it's drawing upon those and expanding our view of who are our healthcare providers. It's not always the big health systems. We may not always need them. I have received services at these health centers, and they're phenomenal. So we need to elevate awareness around them as a means to deal with the cost of it, because they have the creative solutions as well.
Absolutely. Thank you. This next set of questions really has to do with Tower Health, and I think people are just curious because we don't want this to keep happening to our community. And so I believe it was you, Commissioner Moskowitz, that talked about licensure and Tower Health's license. And I think people are asking a little bit of clarity on the use of Tower Health license by buyer. What does that mean, and what does it mean if it exceeds the deadline? So I think people just need a little bit more clarity around what is the impact of that and what does that really mean.
So I'll try to give you a little clarity. I'm sorry if I wasn't clear before, because it is a little confusing. So the way I understand the regulations is that when a hospital closes, like Tower Health, they have a year from the date of closure to sell that to another operator, and that operator can use Tower's license going forward. And that after that year of closure, that license is no longer transferable. And they would have, whoever would come in would have to start anew. That's an entire process, and I don't know what that process is. I know it includes hearings and all kinds of things. It's not easy to get a license. But there is that deadline. I have not heard that there's been an extension to that. And unfortunately, our Pennsylvania Secretary of Health left in the middle of this. She did put together some new guidelines, and we were working with her. And as of that moment, they had not given an extension. I don't even think one was asked for. So what that means is that certainly for Jennersville, I think it was December 1st that they closed. And so they would then have a year from that date to use that license, or that license expires.
Thank you.
Is that better?
Yeah.
Do you
That's
understand?
better.
Was that a little clearer?
Is that clearer?
Okay.
Yeah, perfect. So I have another question about Tower Health, but I want to make sure that I'm interpreting it correctly. So I'm going to ask the person who gave me this lovely card, and it starts out with, what is Tower's historical sales activities, to sort of expand on that question, because I want to make sure that I'm asking the question correctly. Anybody want to own up to this card of that question? Because I just want to make sure that we're asking it. Oh, he's not here. So we can make it up then. So here's the question. So the question, I believe, is trying to get at, what is Tower's historical sales activities? Are they more community oriented? Is it traditionally another hospital? Or is it sort of the largest bidder? I think people are just trying to get a sense of what could actually happen with that site, particularly because what is the site actually zoned for? I don't know if any of our panelists want to tackle that question.
I don't think there's any track record.
Okay.
I don't think there's any track record by Tower to really evaluate that question.
Okay, perfect. Thank you. Well, we did ask, so we did ask. So the next question is, what role could public libraries play in easing the pains of hospital closures? Linwood, I'm going to turf that to you, because that's a community asset that can be built upon.
I think public libraries would play a major role. Again, we're talking about an entity already present in the community, in the neighborhood, where whichever partnership or health initiative that you desire, at least the trust factor would not be a challenge. Also, again, access, which is important. We're not going to call it a mini qualified health center, but nevertheless, let's say it would be a space. And one of the challenges in communities like Coatesville and Jennersville are really, it's finding places above the hospitals, and in some cases even beyond the federally qualified health centers to do health care because of timing. And for example, if you're talking about a library and maybe partnership with a civic organization that had a space, they could work together and offer, let's say, just basic screenings.
Yeah.
Screenings. Again, when we talk about partnerships, it's well beyond even what we think. In many cases, it's more than the house of faith and faith-based organizations.
Yeah, that's great. I do know that there's a model in Philadelphia with their Department of Health whereby in their community clinics, the Philadelphia Library partnered with one of their clinics, and they're actually physically located in the clinic, and they built a park around that clinic. So that's an example of how you integrate healthcare into community and use those assets. So those models do exist, so that's a great question. So this next question is for you, Pat, and it talks about mental health. Do you think mental health crisis will improve as we emerge from COVID, or are we preparing for its escalation? Good question, Kelly.
Well, I'm not sure that we know, but there are trends both in adults and especially our young people, the schools, that really speak to the need to ramp up a pretty strong program of what I described before. So I don't think we're at a time coming out of the pandemic where there are some resources. The county's American Rescue Plan application was due last Monday. The state has some American Rescue Plan Act funds as well that they're working through, determining how to do it. We're looking, as we plan for the mental health crisis response system, in a way that's going to be as robust as the need is. And we're going to start with where we are now, but if there is the need to expand or contract if the need isn't, you know, expanding and it doesn't grow. But I think we need to step up to the need and soon. I hope that answered your question.
Absolutely.
So, and I'm always on, you know, thinking on the prevention side. I think regardless of whether we are ramping up or not, it is the prime time to talk about it. It really is. You know, I was on a Zoom call during our COVID response, and there's a psychiatrist on it, and it was all about the schools and the impact of the students being remote, et cetera, and how are we ever going to get them not only academically caught up, but recognizing that there were so many simmering mental health challenges that just popped, you know, almost blew the lid off the pot, if you will. And that psychiatrist said very frankly, and it kind of took me back, said, where have all these parents been before COVID? It's always been there. But now that we have experienced a common event, not a similar experience, because everybody's experience has been, you know, different, but the same event, it put it on the agenda to talk about it, and we have to take advantage of that while we're also putting a whole system into place. We need to make it normal to talk about it. I try to do it in my own family. It's okay, honey. It's okay, buddy. You can say what you're feeling. I may not have the answer. I'm just mom. But you know what I mean? So I think this is what we have to capitalize on. And I think we're seeing some of that action being put into schools to say it's okay that you need help, regardless of what it is. And that will help start chip away at the need to even be in the system. The need, you know, the system will never not be needed, but how many people we prevent needing to walk into it is, you know, something we have to capitalize on now.
That is true. It takes away this. It opened it up to allow us to take away the stigma. Go ahead, Linwood.
I think, again, from the community standpoint, well, actually from every stakeholder here, with the initiatives, when we begin the initiatives, do our best to try to support that particular initiative to make it sustainable. That's one of the challenges that we have in health initiatives and all the challenges that we have. Will it be in place a year from now, two years from now? And it would be great if we could even make it an institution. That would be even better. Of course, with modifications depending on the times. But in many cases, we start new organizations and new initiatives, and we dilute our efforts. So I think it would be great to just everyone say, hey, we're going to support this from every sector, the school system, from organizations, and I think we'll have better results. And I wanted to say something else about better results. It'll come back. Maybe I'll get better results, and thank you.
Well,
And it doesn't take much to sustain talking, does it, Linwood?
So hold that thought, Linwood. This next question is for Commissioner Moskowitz, and it is about Tower Health, and it's a two-part question. Who's maintaining Brandywine Hospital campus now, and how are they doing it? And then the other part of that question is, are there any outstanding bills that the buyer would inherit?
Another complicated answer. So it is Brandywine's responsibility to maintain those facilities. They own them, and they're supposed to maintain them. I don't know what's going on inside them, but they are supposed to, it's private property, but they're supposed to maintain them. As far as the next question. I just drew a complete blank.
I'll read
Yeah, I
outstanding
But
bills.
it's not-
It's bigger than that,
it's
isn't
not,
it?
Yeah, it's bigger than that.
that.
And so it's not, okay, this gets it's not just for Tower about outstanding invoices like your electric, your gas bill. They have borrowed on the medical office buildings and on those sites, those pads that are there. And so they've borrowed so much and out 20 years that for a buyer to come in and take that over, they would have to take over that debt. It's not a debt that will get wiped out in bankruptcy if they go bankrupt. It's not a debt that will be forgiven. Somebody, whoever comes in there is going to have to take over that debt. And that has been one of the big stumbling blocks to a sale. The lien holder will not reduce it. They will not let Tower out of it. So it's either got to be paid or absorbed by a buyer. And that's one of the major difficulties with this transaction. I'm sure there are other bills too, but that's
Is it exactly 7 o'clock?
that is the main one. And I think they're covering their normal bills, but
Yeah. So I think we have gotten through a lot of great questions, and some of the outstanding questions I think were already answered in a variety of different ways. And so I'll end with this last question. If someone knows, and unfortunately, Commissioner Moskowitz, I feel like I'm picking on you today. But anyway, you may or may not know this particular answer. Why did Tower Health buy Brandywine anyway? I think that is a perfect question to end the panel discussion.
I don't know, but I don't know the answer to that. I don't know that I ever will. But, you know, they also bought Chestnut Hill, right? That was another one that they thought they had sold, and they did not. So they're still holding that one. And Phoenixville and Pottstown they had. So I think it was an expansion mode, as some hospitals did, you know, before the recession back in 2009. And I think that's one of the things, this kind of thing is occurring across the country now, where hospitals, especially for-profit hospitals that have taken on more than they could chew, are leaving the communities like we're getting it here.
Yeah. Thank you. Well, I think we had some great questions and some great conversations. So I want to thank all those that are in person and on Zoom, and I'm going to turn it back over to Nick to close us out.
Well, thank you to our participants here and online, and a special thanks to our panelists and speakers. A very educational session. And again, we have the leadership group and the health coordinator group and the advocacy group will continue this work. I think the most important thing now is for us to complete the survey so we get a real understanding of the community needs, and using that information we can plan forward and provide that information. As I think Jeanne said, there's 2 uses for that, and give it to the new hospital owners, whatever they may be, but also more importantly that we come together as a community and really say, how do we continue the work that we do? So thank you, Linwood, thank you, Harry, thank you, Patrick, Jeanne. And last comments, and you'll get the last comments because we had you on the agenda, but Pat.
Just a quick question. Do you anticipate getting back together to share the results of the survey?
Absolutely. Yep. I'm speaking for Vanessa because she doesn't have the mic. So absolutely, yes. Yeah. So Commissioner, would you like any final words?
Sure, certainly. I want to thank you both so much, and thank all the panel. You know, our staff has been living the dream since January 2020, and they're always there standing up to this challenge. But the community in itself is so resilient everywhere. And it's so great to see people interested in each other and caring for each other, because that's something that I don't see very often these days. So I am very grateful to all of you for caring enough to be here and for being partners in this endeavor to make sure that Chester County is stronger when this is done than ever before. So thank you again. I really do appreciate everybody's hard work and for being here. Thank you.
Thank you.